Welcome to a new session on the course School Organization, Administration and Management. In this present session, we will discuss on topics like physical fitness tests based on components, physical activity and exercise, relaxation, exercise and safe heart rate, basal metabolic rate and exercise. First, we shall discuss physical fitness. Physical fitness is a basic requirement for most of the tasks to be undertaken by an individual in his or her daily life. Physical fitness is the capacity to carry out reasonably well various forms of physical activities without being unduly tired. A physically fit individual is capable of withstanding fatigue for longer periods, better equipped to tolerate physical stress, more efficient circulatory and respiratory systems, more efficient and stronger heart, and exhibits good mental alertness and absence of nervous tension. In the words of Charles A. Butcher, if you are physically fit, your body systems functions efficiently. You have sufficient strength to engage in vigorous physical activity, you recover quickly from fatigue. You have reserves of strength, energy, stamina for emergencies. Physical fitness is one's richest possession. To be a totally fit person, one must also possess emotional maturity, high ethical standards and ability to get along with others. In contrast with physical activity, which is related to the movements that people perform, physical fitness is a set of attributes that people have or achieve. Being physically fit has been defined as the ability to carry out daily tasks with vigor and alertness, without undue fatigue, and with ample energy to enjoy leisure time pursuits and to meet unforeseen emergencies. A number of measurable components do contribute to physical fitness, and the most frequently cited components fall into two groups, one related to health and the other related to skills that pertain more to athletic ability. The health related components of physical fitness are cardiorespiratory endurance, muscular endurance, muscular strength, body composition and flexibility. Just as the amount of physical activity ranges from low to high, so does the level of physical fitness. Physical fitness is very important from various angles, and some of the points we shall just discuss. First is enjoyment of a better life. With physical fitness, one can enjoy a better life, better social status, more happiness and more satisfaction in life. The next is efficiency for facing emergencies. It imparts endurance and efficiency for facing emergencies and stress situation in life. Prevention of premature aging. Physical fitness prolongs life by preventing premature aging. Development of personality. Physical fitness program leads to proper development of all the physiological systems and the body posture. This develops one's personality by providing grace, smartness and agility in different walks of life. Prevention of minor ailments and diseases. The pressures and tensions of modern rapid life generally cause depression, high blood pressure and even heart attack. But physically fit persons can avoid such common ailments with their stamina and endurance power. They can withstand the stress and strain of competitive activity with their strength and energy, so they can give a better performance in games and sports. We shall now discuss the various physical fitness tests based on their components. Different types of physical fitness tests can be used to understand the physical health. There are tests that focus on gauging your strength, stamina, flexibility and more. Tests can focus on one particular physical trait, a combination of two or several, and even your overall physical fitness. There are 5 of the most popular and commonly used physical fitness tests. The first is the Bruce test. Designed to evaluate cardiovascular performance, the Bruce test was designed as a clinical treadmill stress test. The purpose was to diagnose patients with suspected heart diseases, and the results would point to possible coronary problems. Today, this physical fitness test is also used to measure VO2 maximum or maximum oxygen intake among athletes. You begin on the treadmill at a manageable pace and incline. At certain levels, both incline and treadmill speed increases until your threshold is reached. The second one is Illinois Agility. This test is also called the Illinois Agility Run. This physical fitness test was designed to determine agility. The running course is composed of cones lined up and a set running track that crisscrosses around the cones. This determines your capability to quickly turn in other directions while running at a high speed. And the third one is the Harvard Step Test. This is also a test for cardiovascular function. This test can easily be administered at home. All you need is a 12-inch high bench or box to stand on and a stopwatch. For 3 minutes, simply step up and down the platform at a steady pace. The time how long it takes for your heart rate to normalize. The shorter the interval, the better your cardiovascular function is. This physical fitness test is also known as the cardiac stress test or cardiovascular endurance test. The fourth one is the beep test. This test is also commonly known as shuttle run. Some also refer to it as the pacer test or 20-meter shuttle run test. To start this test, cones are placed 20 meters apart from each other. Then run to and from each cone according to recorded beeps. A specialized beep test CD may be required for this. The interval between beeps gets shorter, thus requiring you to run faster. This physical fitness test is generally used to measure VO2 max. It is also an indication of your endurance and aerobic energy. The fifth one is vertical jump. This is another test that you can do at home with very minimal requirements. This is used to determine leg muscle strength. It is sometimes called the vertical leap or sergeant jump, named after American physical education pioneer Dudley Sargent. To perform the test, you attempt to reach the highest point on a wall by jumping. Here we will have a discussion on physical activity and exercise. Physical activity. Physical activity fosters normal growth and development, can reduce the risk of various chronic diseases, and can make people feel better, function better and sleep better. Some health benefits start immediately after activity, and even short bouts of physical activity are beneficial. The Physical Activity Guidelines for American 2nd edition outlines the amounts and types of physical activity needed to maintain or improve overall health and reduce the risk of chronic diseases. It also highlights individual and community level strategies that can make being physically active easier in the places where people live, learn, work and play. Physical activity, exercise and physical fitness are terms that describe different concepts. However, they are often confused with one another and the terms are sometimes used interchangeably. Physical activity is defined as any bodily movement produced by skeletal muscles that results in energy expenditure. The energy expenditure can be measured in kilocalories. Physical activity in daily life can be categorized into occupational, sports, conditioning, household or other activities. Exercise is a subset of physical activity that is planned, structured and repetitive and has a final or an intermediate objective, the improvement or maintenance of physical fitness. Physical fitness is a set of attributes that are either health or skill related. The degree to which people have these attributes can be measured with specific tests. Several elements of physical activity have been identified. Physical activity is defined as any bodily movement produced by skeletal muscles that results in energy expenditure. The amount of energy required to accomplish an activity can be measured in kilojoules or kilocalories. 4.184 kilojoules is essentially equivalent to 1 kilocalorie. Expressed as a rate, kilocalorie per unit time, the amount of energy expended by each person is a continuous variable ranging from low to high. The total amount of caloric expenditure associated with physical activity is determined by the amount of muscle mass producing bodily movements and the intensity, duration and frequency of muscular contractions. Everyone performs physical activity in order to sustain life. However, the amount is largely subject to personal choice and may vary considerably from person to person as well as for a given person over time. Physical activity during monthly, seasonal or yearly periods may also be examined to establish the stability of physical activity for longer time periods. Categories of physical activity. Physical activity can be categorized in a variety of ways. A commonly used approach is to segment physical activity on the basis of the identifiable portions of daily life during which the activity occurs. The simplest categorization identifies the physical activity that occurs while sleeping, at work and at leisure. A simple formula can be used to express the caloric contribution of each category to the total energy expenditure due to physical activity. Kilocalorie sleep plus kilocalorie occupation plus kilocalorie leisure is equal to kilocalorie total daily physical activity. The caloric contribution of each category to the total energy expenditure due to physical activity is basic metabolic rate and does not include the effect of diet induced thermogenesis, which is the energy expenditure above the metabolic rate in the resting state. The energy expenditure due to physical activity during sleep would of course be small. Meaning and concept of physical activity. Physical activity is defined as any bodily movement produced by skeletal muscles that results in energy expenditure. Examples include doing housework, carrying buckets or laundry, walking upstairs. Physical activity is positively correlated with overall fitness of an individual. The energy expenditure can be measured in kilocalories. Physical activity can range between light, moderate and vigorous type of activity. For example, doing the household chore of washing dishes would be considered a light physical activity, whereas scrubbing the floor on your hand and knees with a hearty effort would be a vigorous activity. Exercise is any improvement that is planned and done purposely to maintain or improve physical fitness. Examples of this type of movement include running, yoga, spinning and cycling. Performing regular exercise can improve aerobic capacity, muscle strength and bone strength, and exercise is also positively correlated with the overall fitness of an individual. Exercise is the key to sound health. Sound health aids physical fitness. Therefore, we must take regular exercise in order to keep fit and healthy. Exercise provides adequate quantity of oxygen and enables different organs of human body to function properly. It promotes the circulation of blood to all parts of the body. And there are some points to be noted in this connection. Exercise develops muscular systems in the body. Muscles can also be kept in tone. Toxic products are eliminated from the bloodstream. Exercise peps up metabolism. Exercise is a brain stimulant. Exercise keeps the nervous system in order. Exercise helps in the proper functioning of the organs in human body. It also makes them strong. Exercise brings joy to man. Exercise is a natural thing for man and helps in the fullest development of man's personality. But an important thing to remember is that exercise should be done in the open air and regularly. There should be no break in doing exercises. Proper care should be taken to perform only graduated exercise. It should be started with a minimum practice and then slowly increased. It should not be done to the extent that one becomes tired or fatigued. Moreover, consideration of age should always be kept in mind while doing exercise. We should do exercise for our own sake in order to keep our body in perfect condition. Every man or woman must be a judge of how much exercise he or she needs. There cannot be any hard and fast rules to regulate it. But it is better one plays some outdoor game regularly, for a game gives both physical exercise and pleasure. Relaxation. Rest and relaxation is another way to keep our body in perfect order. There should always be reasonable limits to the amount of work one does. Relaxation means ceasing to make any effort or doing any activity. Absence of activity helps in the relaxation of muscles. It is a natural process in man, just as breathing is. But relaxation should not be confused with sitting idle. On the other hand, it means loosening the drive chain on human mechanism. Relaxation helps us to know the method of preserving our energy. It prepares man for more effective activity. Relaxation keeps a man ever young and energetic. How to relax? Body's slant position is the best way to relax. The body should be made to lie in a slanting position with head lower than the feet, with the spine straightened and the back flattened. In this position, all sorts of accumulated congestion in the bloodstream and tissues is released thereby. There is more free circulation and flow of blood in the body. Every organ in the body gets rest in this way. Stomach lift. Another way to relax effectively is the stomach lift. When the body is in slanted position, the stomach lift can be done by drawing the stomach in and then after some time by drawing it out. This process may be repeated a number of times. It enhances longevity of life. Next is avoiding addiction to smoking and alcohol. Excessive smoking hinders digestion and respiration. Nicotine deposited by cigarettes has an ill effect on one's appetite. Smoking irritates the lungs and the throat. It causes irregularity of heartbeat, enhances pulse rate and increases blood pressure. Excessive smoking may also bring an attack of angina. It also leads to insufficient sleep and even nervousness. Therefore, excessive smoking should be avoided. Alcohol consumes vitamin B because it is a carbohydrate. So, when a person takes alcohol, the metabolic process that ensures take away vitamin B from the body and thus causes deficiency of this vitamin. The body is thus weakened. Addiction to other intoxicants such as opium is also very harmful to health. So, we should avoid it at any cost. Similarly, sleeping pills are also bad for health. Exercise and safe heart rate. A linear relationship exists between intensity and heart rate. As exercise intensity increases, so does the heart rate. Exercise directly affects the activity, function and health of your heart. In the short term, our heart rate increases in proportion to our level of exertion as you exercise. Regular aerobic exercises strengthens our heart over time. As our cardiovascular fitness improves, the level of heart rate increase necessary during strenuous activity diminishes. Maximum heart rate. Maximum heart rate is the highest heart rate cardiovascular system can effectively cope with during physical activity. A simple way to calculate MHR is to subtract one's age from 220. However, certain medications and physical factors can cause the MHR to be higher or lower. Intensity level and heart rate. During low intensity exercises, the heart beats well below its maximum rate. As exercise intensity increases, the heart rate moves closer to its maximum rate. Low intensity exercises raise the heart rate to 40 to 50% of an individual's MHR. Moderate intensity exercises increases the heart rate to 50 to 70% of the MHR, while vigorous intensity exercises elevates the heart rate to 70 to 80% of the MHR. Target heart rate zone. The target heart rate zone is the optimum level to exercise and reap the maximum cardiovascular and weight loss benefits without overworking the heart. To determine your target heart rate, you need to know your MHR and the intensity level of your workout. It is recommended that you exercise within 55 to 85% of your maximum heart rate for at least 20 to 30 minutes to get the best results from aerobic exercise. The MHR, roughly calculated as 220 minus your age, is the upper limit of what your cardiovascular system can handle during physical activity. The basic way to calculate your maximum heart rate is to subtract your age from 220. For example, if you are 45 years old, subtract 45 from 220 to get a maximum heart rate of 175. This is the maximum number of times your heart should beat per minute during exercise. Basal metabolic rate or BMR is the minimum caloric requirement to sustain life at rest in a day. It is the amount of calorie required to maintain life at rest per day. It is the energy required for functioning the vital organs like heart, lungs, liver, kidney, skin, etc. BMR is calculated by oxygen uptake. It is an indirect method of assessing the BMR through oxygen consumption. BMR is determined by genetic and environment factors. Factors determining BMR are age, body weight, surface area of the body, posture, heredity, sex, activity, body temperature, fat percentage, diet and mental conditions. Calculating BMR. There are two methods for calculating the basal metabolic rate. They are indirect calorimetry and equation method. The first one is indirect calorimetry. This is the accurate method of calculating the BMR. A specially designed laboratory is used for assessing the oxygen intake of the individuals for calculating the BMR. The second is the equation method. This is the formula method for calculating the BMR. Values of height, weight, age and sex of the individual have to be taken for assessing the BMR. Separate formulae are used for men and women. Exercise. Physical exercise is any bodily activity that enhances or maintains physical fitness and overall health and wellness. It is performed for various reasons, including increasing growth and development, preventing aging, strengthening muscles and the cardiovascular system, honing athletic skills, weight loss or maintenance and also enjoyment. Frequent and regular exercise boosts the immune system and helps prevent several diseases. It may also help prevent stress and depression, increase quality of sleep and help promote or maintain positive self-esteem, improve mental health, maintain steady digestion. Physical exercise may help decrease some of the effects of childhood and adult obesity. Aside from the health advantages, these benefits may include different social rewards for staying active while enjoying the environment of one's culture. Many individuals choose to exercise publicly outdoors where they can congregate in groups, socialize and appreciate life. The term exercise has been used interchangeably with physical activity and in fact both have a number of common elements. For example, both physical activity and exercise involves any bodily movement produced by skeletal muscles that expends energy, are measured by kilocalories, ranging continuously from low to high and are positively correlated with physical fitness as the intensity, duration and frequency of movements increase. Exercise, however, is not synonymous with physical activity. It is a subcategory of physical activity. Exercise is physical activity that is planned, structured, repetitive and purposive in the sense that improvement or maintenance of one or more components of physical fitness is an objective. Exercise then is a subset of physical activity and may constitute all or part of each category of daily activity except sleep. However, it is more likely to be an important part of some categories of physical activity than of others. For example, virtually all conditioning and many sports activities are performed to improve or maintain components of physical fitness. In such instances, they are planned, structured and more often than not repetitive. Activities such as occupational, household and many daily tasks are typically performed in the most efficient manner possible. These physical activities are done with little regard to physical fitness and are often structured with conservation of energy expenditure as a goal. Let us see some of the principles of exercise. There are certain fundamental principles regarding exercise. One should be aware of these basic concepts in order to maximize the effectiveness of the exercise program. The personalized program should be designed to reflect these principles in a manner that the goals can be accomplished. These are some basic principles of exercise and knowing them may help to set up and manipulate different components of the workout. The first is frequency. Adequate frequency of exercise should be ensured as per the requirement. 3 to 4 days for health related physical fitness, 4 to 6 days for managing diseases and performance related physical fitness. The second is intensity. Intensity of the workout may be as per the specific goal. 60% to 85% for health related physical fitness, and 75 to 100% for performance related physical fitness. The third is volume or duration. Duration of the program may be fixed as per the requirement. 30 to 60 minutes for health related physical fitness and 60 minutes and above for performance related physical fitness. The fourth is load. Load should be increased progressively, that is a staircase method. Fifth, maintenance and continuity. To maintain physical fitness, continuity is very essential. The sixth one is personalized training. Personal differences like age, sex, ailments, etc. have to be taken into consideration. Seventh is climate. Workout should be planned as per the climatic conditions. Eighth is technical expertise. Physical exercises should be practiced under the supervision of a professional expert. Let us now summarize what we have just discussed. Any bodily movement produced by skeletal muscles that require energy expenditure is physical activity. Regular and moderate physical activities such as walking and cycling have significant health benefits. It can reduce the risk of cardiovascular diseases, obesity, hypertension, diabetes, depression, etc. Also, adequate levels of physical activity will decrease the risk of a hip or vertebral fracture and help to control weight. Physical exercise is any bodily activity that enhances or maintains physical fitness and overall health and wellness. Exercise is performed for various reasons, including the strengthening of muscles and the cardiovascular system, sharpening athletic skills, losing or maintaining of weight, and for enjoyment. Frequent and regular physical exercise boosts the immune system and helps prevent diseases such as heart disease, cardiovascular diseases, diabetes, and obesity. Exercise should be based on both quality and quantity. It should be purpose oriented. Effective and scientific exercise program should be planned to keep the heart rate between 50% to 85% of maximum heart rate during the exercise. Thank you for watching this session on physical fitness, physical activity and exercise. See you again with a new topic another day. Thank you.